Hi, I'm Dr. Miceli, and congratulations on taking this first step to helping yourself. I'm excited to share some information that could change your life. So, first thing you need to know is those of you sitting at home who have been diagnosed with a thyroid problem, you've gotten a test, the doctor said, yes, you've got a thyroid problem, and you've been put on medication, and yet you still continue to have symptoms. And these symptoms can be one or all of the following things. I'll just name them. So you've got weight gain or difficulty losing it or keeping it off, low energy, just exhausted all the time. You don't have the energy to keep up with your kids, your grandkids. You don't want to go on vacation with your spouse. You don't want to do anything. You just want to sit around. You want to lay on the couch. House chores, just everything is just rough. You don't want to do that. And it doesn't, I mean, males and females affected the same, exactly. So one of the other things too is that affects a lot of people is anxiety and depression, and those are usually treated as if they're this separate thing, but they very much can go along with thyroid. Moody, irritable, mood swings for no apparent reason at all. Dry skin, very rough dry skin is another symptom. Digestive problems, irritable bowel syndrome type symptoms can go along with it. Hair thinning or hair loss, not necessarily balding, just thinning. And then the outside edge of the eyebrows thinning, that's a very common one too. Nails being brittle or nails not being in very good shape is another one. Cold when other people aren't, or hot, like your thermostat is just broken. Night sweats, heart palpitations, racing heart rate, forgetfulness. Where did I put my car keys? What happened to my phone? Has anybody seen my whatever? Low sex drive is another one, very common that we hear. And the list actually goes on and on and on. And a lot of these things can be attributed or can be categorized with other diseases or other things, but often they're from thyroid or they're thyroid-like symptoms, if you will. So that's one. That could be your story. It could be that you're the person that's been diagnosed, put on medication, thyroid replacement hormones like Synthroid, levothyroxine, something along those lines, Armour, there's a bunch of them. And then you continue to have those symptoms, and you're confused because you said, wait a minute, I got diagnosed, this was supposed to be the problem, and now I'm being treated, and I still have these symptoms. So we'll come back to why in just a minute. Or you could be the other person that's watching and you say, well, I've been to my doctor like I don't know how many times and I keep complaining about these symptoms, and yeah, he's checked my blood work, he's checked my thyroid, and he keeps telling me it's normal. He says, your tests look normal, your tests look normal. Here, try a sleeping pill. I don't know, if you want to lose weight, you should eat less. Or, oh, this is a classic one. Well, you're just getting older. Okay, so you're getting older. I see people that are older all the time that feel great, look great, and they're healthy. So I don't buy the getting older thing. But my point is that you guys will go, you'll get tested, they'll run this test, and it'll say, no, you don't have a thyroid problem, and yet you still can have a thyroid problem. The test that's being used is a thyroid stimulating hormone test, a TSH test. And it's the gold standard to measure thyroid function. The problem is you could take somebody who has thyroid disease and you could test their thyroid hormone every single month, all the way throughout the year, and you may only find 2 times or 3 times throughout that entire year, 3 tests out of 12, maybe 1 test out of 12, that actually shows an imbalance. Yet that person is sick. So sometimes it's the timing of your test, and because we're measuring hormones with that test, they fluctuate. Hormones go up and down daily. So you can get tested for 10, 15 years sometimes before it's found that you have a problem with your thyroid, but you've had one all along. And unfortunately, it is, the gold standard. There are other tests, however, that can give clues and show evidence that there is a problem there before it shows up on that test. And we do run some of those tests we run a lot of those tests actually in our office. Because a lot of times the people that come to us, and if you're sitting at home, you can probably relate to this, you've been to several doctors, you've been multiple times, you've been to the specialist, you've been here, you've gone. They said they could help you. They tried, and you still feel awful, or you just basically don't feel like yourself. You're not you anymore. And that's probably the number one complaint that we hear on a regular basis. I don't feel like myself anymore. And that's really sad because it doesn't have to be that way. So either you're sitting at home and you have not been diagnosed and you've got symptoms, or you have been diagnosed, you're being treated, and you've got symptoms. Either way, you've got symptoms and you want to know why. There are so many different factors that can contribute to symptoms, because someone can have the same symptoms as someone else. Two people can have the same exact symptoms, but for different reasons. So it's very important to understand that. So every individual is unique, every individual is different, and what it really comes down to is more extensive testing. Because if you can do entire thyroid panels instead of just one thyroid test, and you can run other tests that show evidence that there is a problem in this endocrine area, then you can really start to find the problem. And then when you start to find those problems, you can come up with solutions for those problems. And that's really what makes a huge difference in someone's health. I hope this helped. I hope the information really sheds a little light on some of the questions that you might be having, and appreciate you tuning in.
If you are suffering with a thyroid problem and/or think you have a thyroid problem, call us today to get the answers you're looking for. Call 771-8552. Call now.